All right, as people are coming in today, hello, I'm Dr. Jim Borchers, the President and CEO of the U.S. Council for Athletes Health and also the Chief Medical Officer for the Big Ten Conference. With most winter sports fully into conference action and spring sports practices getting underway, we're grateful to you all for taking time to join us for the first USCA virtual discussion of 2022. After our webinar on December 23rd that focused on Omicron-related COVID updates, several individuals used the post-event survey to ask for more information regarding return to play protocols. If you have questions today, it's always our goal at USCA to provide answers, so we'd like to address some of the best practices and guidelines around return to play protocols today. We'll also talk about the updated CDC guidance as it pertains to athletics and some COVID special topics in sports, such as multi-team tournaments and testing. As always, today, you're welcome to use the Q&A function to direct questions to our panel, and we will do our best to respond directly or answer them live. Please be patient as we strive to balance answering participant questions and keeping the conversation moving forward. I want to remind you that a link to view the webinar will be made available to all who registered and will be emailed from info@usca.com approximately 90 minutes after it ends today. If you do not see it within 2 hours, please check your spam folder and mark the email as safe to help future emails get delivered promptly. One final note before we begin. Because of the impromptu nature of today's discussion, unfortunately, we are not able to offer CEUs for athletic trainers. And now today, I just want to introduce the other members of our panel from our USCA team taking part in our discussion. Many of you are familiar with Dr. Chad Asplund, who's the Executive Director here at USCA, as well as a sports medicine physician and professor of family medicine and orthopedics at the Medical College of Georgia. Chad currently serves as the medical director for USA Basketball and a team physician for USA Hockey, USA Triathlon, and Georgia Southern University. Dr. Doug Augerman is with us again today, and Doug is the executive director of the Athletics Healthcare Administrator Association here at USCA, as well as the senior associate athletic director for sports medicine at Oregon State University and a sports medicine physician at Samaritan Health Systems. As I mentioned, my name's Dr. Jim Borchers on behalf of USCA. I hope you find today's discussion on Omicron in athletics and return to play informative and engaging. And so Doug and Chad, let's get right into it. I think after our last webinar, we've seen continued updates from the CDC and questions that really probably they were not considering to impact athletics, but certainly are impacting athletics at a really high level. And so I think let's start by tackling some of those guidelines that came out around isolation and quarantine, and certainly some of the challenges that folks have had or questions that they've had around guidance for return to athletics. So let's talk about individuals that are asked to isolate at this point in time. I think, people are familiar with the CDC guidance on isolation now, reduced to 5 days, and certainly then strict masking if you're asymptomatic for the next 5 days. But as it pertains to return to sport, the CDC has now come out with recommendation for testing on that 5th day, and then, provided some particular guidance. A number of organizations, institutions have talked about the use of testing to end isolation to be able to return to athletics, and specifically returning to athletics with or without a mask. And I guess, Doug, I know you've had a lot of discussions in this area. Maybe just some comments and some of the considerations, as we know it wasn't CDC's intention to provide these guidelines for athletics.
Yeah, wow, what a 2-week time span difference has made, right? Drastically different guidelines from the CDC. They appear to be getting tweaked and updated almost daily. I highly encourage everybody to keep going to the CDC website and clicking on the What's New button, because it seems like almost every day there's adjustments to what they're putting out. Clearly the CDC is making recommendations for the entire population, right? They're looking at old people, they're looking at young people. They're not looking at a smaller subset that we all on this call are interested in and concerned about, being, college aged ranged individuals who are physically active, otherwise healthy for the most part, with rare exceptions. So I think we can use the CDC changes as framework and look at the science that we have before us, and those things that have been reported and case reports that have been reported to help us guide us in our decisions on appropriate guidance for this college athlete population. It will continue to change as more and more data comes out. I think most of us have some experience with testing individuals 5 days, 6 days, 7 days out after a positive test for COVID. And what percentage of those continue to test positive? I think that information, that data may change as we go forward. I think there's still a lot we don't know about the infectiousness, especially as it relates to sport. And, I think it'll be interesting to see how things change as time goes on, because I do think in the next 3 to 4 weeks, we're going to see a whole lot more data.
Chad, from your standpoint, as you think about the positive individual that Doug was talking about in isolation and that release at 5 days, if that individual really CDC, regardless of their vaccination status, but I think especially for those that are vaccinated or vaccinated and boosted, in using that negative test at day 5 to allow for some return to athletics. And a number of public health experts, infectious disease experts have discussed kind of in the right setting that is maybe a reason then to think about allowing an individual to unmask for athletic activity. And I think that next days 6 through 10, obviously local public health plays a big role in what you're able to do, with these new guidelines. But just thinking about it, and this population that Doug mentioned, your thoughts on using that test at day 5 and some of the guidance that our experts and I know you've helped develop and provide for college athletes.
Yeah, I think, what we know about fully vaccinated, fully net vaccinated and boosted people and sort of the disease and the virus shed is that typically around day 3.5 or 4, in these populations such as USA Basketball or the NBA, where they're testing very regularly, we're seeing that a lot of that viral shed is gone by day 4. And so I do think when we think about the vaccinated and certainly the vaccinated and boosted population, the viral loads that they're attaining are much lower. That's going to, lower their ability to spread. It's not going to make it zero, but again, they're going to have less virus to start with. They're going to shed it more quickly, and the likelihood that they would transmit it to others is pretty low. I think, we talked about it, that the CDC is putting together these guidelines for populations. They're not really thinking about and I think we're fortunate in our athletic population that we've got such a high rate of people, certainly, fully vaccinated, hopefully fully vaccinated and boosted, also young and healthy. And so I think the risk level is low there. And so I do think with a test at day 5, that those athletes could return to sport unmasked. And I think the chance of spread is pretty low. I would be interested in your thoughts on sort of the CDC's caveat to that, whereas that if you do test at day 5 and it is positive, then they recommend full isolation till day 10 rather than serial testing. And I thought that was just a curveball that they threw out there.
I would also kind of comment, whether you test on day 5 or test on day 6, depends on your test turnaround time. I think that if you can wait till day 6 to do the testing, because you do have to spend 5 full days in isolation, then your likelihood and chance of getting a negative test is probably greater. It gives the person's body more time to neutralize the virus and reduce their viral load. I think the type of test is also very important in what you're going to use. And I think that you have to be smart and understanding of the different test types that are out there and what's more likely to test at a lower viral load.